So I just want to extend a huge welcome to Loughborough, to everybody here today. Loughborough is not only my workplace, but also my home. Unfortunately, or fortunately, I also live on the campus with my family. I'm, in addition to being a senior lecturer in psychology within the School of Sport, Exercise and Health Sciences, which is based all the way on the other side of campus, East Park. We're currently, I think, in West Park. I'm also the Butler Court Hall Warden. So before I begin, I always like a little bit of audience participation. I know it's very early in the morning, so I wanted to ask everybody, and feel free to stand. I'm all about physical activity, or if you're unable to do so, please just raise your hand. So I want you to rate how is hearing related to our general health. So if you think that it isn't related whatsoever, I just want you to raise your hand or stand for 1 or 2 stars. If you're somewhere in between, undecided, I'm a psychologist, so we always rate number 3. Number 3. Or if you think it absolutely is related to our health, 4 and 5. Amazing. My work here is done. I do not need to present anymore. So that's it. Presentation over. No, only joking. So I don't need to convince you. But what I do like to start with any presentation about hearing loss is really bringing up why I think this is important. So I want to highlight the World Report. Sorry, I'm just going to move this because there's a mess. Where's the mouse? There's a message, I can't see the slide and I don't want to look back. So I'm going to give you a definition of hearing loss from the World Report on Hearing, which was published fairly recently in 2021. Now, the World Health Organization identifies that hearing is often referred to as an invisible disability. And that's not just because there's this lack of visible symptoms, but also because it's hugely stigmatized in communities and tends to be ignored by policymakers. In addition, the COVID-19 pandemic has really shown how important social interaction is, and how we need to maintain social contact and remain connected to family, friends, colleagues, and so forth. And that, therefore, we often rely on the sense of hearing to achieve this more than ever before. So you can see here that I'm really trying to convince you that hearing loss is really important. Now, although I'm a psychologist, I formerly used to work at the Nottingham Biomedical Research Centre within the hearing loss theme, which was based in Rope Walk House near Nottingham Castle, if you're from that area. And when I would observe clinics when people were being assessed for their hearing loss, people would often say to the audiologist, or if I was sat in the room, what's caused my hearing loss? Now, the World Report on Hearing identifies several factors that can be associated with age-related hearing loss. We have genetic predisposition, ototoxic medication, excessive noise exposure, and certainly what we're seeing now in young people is a huge increase in hearing loss associated with excessive noise, recreational noise levels. Nutritional deficiencies, which are certainly seen in low in other countries. And something that I really focus on here at Loughborough is looking at unhealthy lifestyle. So we have all these factors, and today, given that I've only got a short period of time, I'm going to focus on our work that's looked at unhealthy lifestyle. Now, when we look at hearing, we need to identify that hearing loss in older adults is associated with a vast number of factors. Individuals with older adults with their hearing loss are at an increased risk of chronic health conditions such as diabetes and cardiovascular disease. Quite unsurprisingly, due to the communication difficulties, they're at risk of poorer psychosocial well-being, such as depression, loneliness, and social isolation. And also there's a growing body of evidence showing that age-related hearing loss is associated with declines in cognitive functioning, including dementia. So we can see here on this picture that I'm showing you here that age-related hearing loss is very complex, is associated with many different health factors, and I cluster these as physical, psychosocial, and cognition. Now, there is work looking at how hearing aids, which is the primary intervention for hearing loss, can mitigate some of these factors. But what I want to highlight is how a healthy lifestyle or healthy lifestyle behaviours can actually mitigate the risk of these conditions as well. And some of the work, unsurprisingly, being at Loughborough, that we focused on is how physical activity can mitigate these associations. Now, one of the reasons that we focus on this, and I was involved with international experts looking at some key recommendations, and what we highlighted was that we really need to take a holistic, person-centered approach when we're managing individuals' health, not just their hearing loss, but their health more generally. Now, what do I mean by holistic? Well, I mean what we need to do now is not just focus on silos, so we don't just treat the hearing loss in isolation. We now need to think about the individual holistically and how all of their health conditions interact. So in this paper, we highlighted that there is a need for hearing health to be promoted, and there needs to be better general awareness in order to minimize the negative health impacts of hearing and related comorbidities. In addition, we need to highlight to healthcare professionals that they need to be aware of hearing loss and how it can be associated with other conditions. And also, we highlighted that hearing healthcare professionals need to be part of an integrated team, an interprofessional team, ensuring that this holistic, person-centered approach can be delivered to older adults. What I'm going to do now is I'm going to focus on one project. This is a fairly recent project and is currently ongoing, which is kind of looking at those recommendations and seeing how it is that we can implement those into practice. So one of the key factors that we've highlighted is whether we can get audiologists or other hearing healthcare professionals to promote healthy behaviours in their clinical practice. So what we wanted to know is, will they encourage healthy lifestyles? And what we wanted to do first of all was to assess the perspectives and experiences of healthcare professionals already with regard to promoting healthy lifestyles. We also wanted to assess whether older adults with hearing loss are already aware of other health conditions that might be associated with this condition. And furthermore, our ultimate goal is to develop consensus towards how we can implement these recommendations into practice. So the first aspect of this study is that we completed semi-structured interviews with hearing healthcare professionals, primarily audiologists, and older adults with hearing loss. And we completed one-to-one semi-structured interviews, exploring their awareness, perceptions, and experiences of the relationships between hearing and health. We also wanted to explore how willing hearing healthcare professionals might be to promote health behaviours during their clinic and whether they considered this to be important. Overall, our results have highlighted the following: that generally there is poor awareness of how hearing and health are related. So adults with hearing loss aren't really very aware of this link. In addition, hearing healthcare professionals are acutely aware of the link, but mostly focus on cognition and dementia, which is really unsurprising given the growing body of evidence in this area. Furthermore, hearing healthcare professionals are really unsure how they can appropriately inform their patients to promote positive health behaviours in clinical settings. And I just wanted to provide you this quote, which I feel really encapsulates that. So this is a hearing healthcare professional who said, "I've had some clients who've come in and I'm asking them about their general health, and they'll say, 'What's the relevance of this?' And I'm not really sure I'd feel going into more depth about things like the risk of diabetes and everything. I think that's more of the general practitioner's role, because I think it might people might get offended if I stop talking about things like that aren't directly linked to hearing." So you can see here that hearing healthcare professionals are really are not very confident about approaching these types of conversations because they don't feel very well equipped or trained to do so, and they're concerned that their clients or their patients might get offended and upset. So taking these findings, what we're currently doing is a 3-round electronic Delphi survey. And this is very much ongoing, but I'm going to present to you some preliminary results that haven't been presented anywhere before. And we've recruited currently 22 UK-based hearing healthcare professionals, both from the NHS and the independent sector. And it was really important for us to get a huge, diverse view of this across sectors. You can see here that our clinicians, our hearing healthcare professionals, ranged from quite a lot of experience, from 4 to 39 years. Our initial round 1 survey was based on the results from our semi-structured interviews. And we've predefined consensus as 80%. And what our goal here is to develop best practice guidelines that hearing healthcare professionals can then implement in practice. So these are the results from our first round, which only we finished collecting on Friday, or sometime last week. So what we've got here is some key headlines that I wanted to show you. So generally, most hearing healthcare professionals that took part in our first round agreed that they should discuss general health with their clients or patients. They also agreed that they should collaborate with other healthcare professionals when discussing general health. And they also felt that they should receive training on how to engage in discussions about general health with their patients. Something that I thought was really interesting was that over half already engaged in discussions about their general health, so clinicians are already doing this. However, 36%, so the minority, felt that hearing healthcare professionals should assess or measure general health in addition to hearing loss. So, just to summarise then, hopefully what I've shown you today is that hearing loss in adults is associated with multiple chronic health conditions, and that actually healthy lifestyle behaviours can reduce or mitigate the risks of these conditions. There's a need to minimise the negative health impact of hearing and related comorbidities, and what our work has really shown is that there is a requirement for greater public health awareness. What I've tried to show you is that clinical appointments might be an optimum time to discuss healthy lifestyle behaviours, and this can really help to ensure there's a holistic and person-centred care approach that's delivered to older adults with hearing loss. So I think I want to finally end on some acknowledgements. I can't take any of the credit for this work. I want to highlight Dr. Maria Goodwin, Dr. Caitlin Slade, Professor Eve Hoggevorst, and our colleague at Sonova who funded this research, Emily Urry. I also want to highlight that Boots Hearing Care have been instrumental in supporting us with this work, and I want to also thank you for your attention today.